Fears of a possible COVID-19 explosion increase in the Republic of Cameroon as the figures continue skyrocketing. The country has hit 4,000 confirmed cases in the Republic of Cameroon, and Muslim faithfuls in the Jamari Division final region of the Republic of Cameroon are daggers drawn with their leaders over restrictions imposed on the celebration of the Ramadan feast, and the Muslim faithfuls in the country and elsewhere are still expecting to see the moon that will determine the day of the feast. Thanks, ladies and gentlemen, for joining us on this edition of the 6 p.m. primetime newscast on Equinoxe Television, live from my headquarters in Cameroon's economic capital, Douala. I am Babler Jonathan. There are great fears now being expressed in the Republic of Cameroon with regards to the COVID-19 figures that have continued rising over the weeks and months. And the Republic of Cameroon yesterday recorded 500 confirmed new cases of coronavirus. The country of President Paul Biya is now counting over 4,000 confirmed cases of the COVID-19. The numbers have been increasing. The numbers as far as deaths, confirmed cases, and also those treated of COVID-19 have constantly been on a speedy increase in the country, notably since the government lifted some of the restrictions imposed on communal life in the nation with regards to the fight against coronavirus. And in the far north region of the country, the population are complaining of inadequate water supply, and this, they say, is a hindrance to the effectiveness of the anti-COVID-19 measures of government and the respect of the sanitation rules of the World Health Organization. Immaculate Fokwe has more.
At a time when constantly washing hands with water and soap has become a habit for most Cameroonians in their fight against COVID-19, the far north region of Cameroon, like many other parts of the country, lack the precious liquid, making the washing of hands extremely difficult. We have neighborhoods that have been without water for over a year, causing the population to cover long distances to get the precious liquid. Every day, we wake up at 3 a.m. to go fetch water. If you don't wake up early, then you will spend the whole day trying to fetch water. We suffer as a result of inadequate potable water. We don't know what to do. We have called on our authorities to address the situation, but no answer has been gotten yet. I wish the government could do something for us. The far north region of Cameroon has registered over 20 cases of COVID-19. Limited access to potable water has made the fight against the virus extremely difficult for the population. Administrative authorities insist that the population should respect other barrier measures. The far north region of Cameroon registered its first COVID-19 case on the 29th of April 2020. Now, we have a total of 27 cases, 17 in Marwa and 7 in Kuseri. The region has registered 2 deaths with 1 recovered case. We are calling on the population to be cautious. To better contain the spread of the virus in the region, hygiene kits such as mobile buckets, face masks, and hand sanitizers have been offered by an association to some councils in the area. Today, the far north is the least infected region in Cameroon, so we have to start fighting the virus so it doesn't spread. We have begun our sensitization campaign in the different parts of the region. Washing hands with water and soap makes a huge difference in fighting against the coronavirus, but access to potable water remains a key problem in the far north region and many other parts of Cameroon.
And still in the far north region of the Republic of Cameroon, the impact of the fight against coronavirus is tearing Muslim faithfuls and their leaders apart. They are now at daggers drawn over restrictions imposed on the celebration of the feast of Ramadan, and the Muslim faithfuls in the Diamare division are sending distress calls to the administration to take off some of the restrictive measures imposed by their leaders with regards to the celebration of the Feast of the Ram in the days ahead of the Feast of Ramadan. Details with Immaculate Fogwe.
For the first time in Cameroon, Muslim faithfuls in the Diamare division, far north region of Cameroon, won't be able to carry out their traditional communal prayers in mosque to mark the end of the fasting month of Ramadan. The information was contained in a radio communique signed by His Royal Majesty El Bakari Yerima Buba Lamido of Marwa. The outbreak of the coronavirus has been blamed for the annulment of the special Eid-filled prayers. The Lamido calls on Muslim faithfuls to pray at home while respecting government anti-COVID-19 measures such as the wearing of face masks, the washing of hands with water and soap, and the social distancing rule. His Royal Majesty El Bakari in the communique warns that any imam or Muslim faithful who will go against the order will be intercepted by the forces of law and order. He further restricts visiting during the feast of Ramadan, a decision greatly contested by the Muslim community of the area. I am against the decision. It is only in the Diamare division that communal prayers won't take place. This is defined in Muslim tradition. Such a thing has never occurred. I am not denying the fact that the coronavirus exists, but if we didn't get infected with the virus in market, then there is no need for such a decision. The Lamido will be answerable to man and God.
Vraiment, le Lamido a beaucoup tort devant le peuple et devant Dieu même.
Marché fonctionne normalement.
Markets are operating normally. It is 9 p.m. and markets are full. The measures taken by the government does not hinder Muslims from praying. The virus is not only found in mosque.
La propagation de COVID-19, ce n'est pas seulement dans les mosquées.
Few hours to the celebration of the Feast of Ramadan, some Muslim faithfuls in Marwa have begun purchasing foodstuffs, shoes and dresses to commemorate the feast.
From the far north region of the country to the northwest regional chief town, Bamenda, where with our correspondent, Stella, we're going to be taking a look at the situation of Muslims in that part of the country. Many of them are facing enormous difficulties with regards to the Anglophone crisis and the coronavirus pandemic, and some of them in the Old Town neighborhood received some assistance from Minister Felix Mbayo recently to help them in the fight against coronavirus. Bustela reports from Bamenda.
At the time the government is preaching social distancing, Muslim faithfuls are coming together during this month of Ramadan, though not as usual for diverse reasons.
We have been praying to the Almighty Allah to at least give us some, we should have peace to return to the northwest and southwest region. That the coronavirus pandemic, God should find a solution to the coronavirus.
We would pray for God. May God make peace for this country. May we get peace. If we get peace, all this is not going to happen for me.
This year, the fasting month has come amid social distancing guidelines due to the coronavirus pandemic.
We will pray plenty inside mosque. Now, because of coronavirus, we know to get for prayer like how we pray first time. Before one enter prayer, we must wash our hand. Not be so we be support for people. We make ambition, but we not be wash hand with savon and how would you wash now.
The government of Cameroon had since asked her citizens to stay home, among other measures, to curb the spread. In Bamenda, chief town of the Northwest region, poverty and hardship characterizes the Muslim month of Ramadan, as the region is also faced by an armed conflict, preventing many from working.
Down no dey go, all thing dey down, all thing no dey go, no small. You see now, we dey wait for door.
This year, tradition is respected as the Muslim community of Old Town are beneficiaries of 50 cartons of sugar and dates, few days to the end of the fasting period, from Minister Felix Mbayu, Minister Delegate at the Ministry of External Relations in charge of the Commonwealth.
This will be like some Samaritan when God don't send him. They like man when you come for save somebody where you don't run today, you remain 1 kilometer to the winning line. Then you will start the testing, you just send them now, will help cross the line. As he help you for cross the line, that's all God will make until he go cross the line for your life for this world.
Ramadan falls on the 9th month of the Islamic lunar calendar. According to Islamic beliefs, it is a month dedicated to fasting, prayers, reflection, and commuting.
In Ebebda, in the central region of the Republic of Cameroon, internally displaced persons are also facing many difficulties. The coronavirus has come to further worsen their living conditions. They were already suffering because they were forced out of their homes by violence in Anglophone Cameroon to seek refuge in that part of the country, in Ebebda, in the central region. And now the coronavirus came to further make difficult their living conditions, and recently they received their phone. The traditional ruler of Wum in the northwest region of the country went to visit his people, bringing to them some aid to help them survive, to help them fight against coronavirus. Details with Equinoxe.
There are about 183 internally displaced persons of the Anglophone crisis living in Ebebda in Yaoundé. Life has not been easy for them for over 3 years today.
We are feeling very difficult here in Ebebda. Even though there are farms, it is not common to just go in a plot of someone to begin working there. You have to pay rentage of the land, you have to pay rentage, house rents, you have to buy for waters, you have to buy food to eat. House here is very, very difficult. If we can pay house for 10,000 francs and you buy food, you are with children. School problem is another level that it is more than us. When we were in Bamenda, we were not suffering like this. Now I'm pleading that the government should see what they can do.
Faced with another crisis, the COVID-19 pandemic, they are not forgotten by their traditional ruler from Wum in the northwest region, who visited them with sanitation materials like hand sanitizers, tap buckets, soap and a face mask, as well as foodstuff to improve their living condition. He used the occasion to address the present situation back at home.
The situation back at home is very, very devastating and shocking, but things are gradually becoming normal. That's why I've decided this is a week of national unity and national integration, to move around and visit my population, though it's at a difficult and a complicated moment, but I'm moving along with materials to prevent the spread of corona. I'm moving with face masks, more than 500, moving with cartons of savons, with buckets, to make sure that I distribute to the population to prevent themselves from being contaminated with this disease. And I want to thank my elite who have supported me in this move, to make sure that I move around all over the 10 regions to visit my population who have been displaced, to make sure that I convince them, talk with them, ensure them that there's security back at home, let them come back. I was in the village last week. I just came back. I'm struggling to make sure that things should be okay and things shall be fine.
He also urged his natives to be respectful and humble while in Ebebda, as well as respect the laws of the Republic of Cameroon.
I advise them not to look for trouble. Let them work hard with their sweat. Let them use their hand to work so that they should feed their family. They farm, there's land here. The chief has given them land to work and cultivate. I want to thank the chief, and I call on them to respect the state institution, to respect law and order.
A gesture appreciated by the IDPs through their leader.
If he was not our father, he would have not come here for the second time to check and bring us something that we can even manage. So everything that our fund has given, as the leader, I'm going to make sure that everybody who is living anything will have some more part of it.
His Royal Highness Fonjo Wilson of Caution thanks the head of state for ordering reconstruction of the ravaged localities in the northwest and the southwest regions, wishing it is realized.
Within the context of the fight against coronavirus, African traditional medicine is gaining more attention. The Archbishop of the Douala Metropolitan Archdiocese of the Roman Catholic Church, His Grace Samuel Kleda, says his herbal medicine has treated over 1,000 coronavirus patients. And the World Health Organization is now supporting Madagascar's fight against coronavirus with its COVID organics traditional medicine, and the organization has signed an agreement with Madagascar after a discussion between the WHO Director General and President Andre Rajoelina. Details with Fomi Armstrong Sander.
Became official late Wednesday, May the 20th, 2020, when Andre Rajoelina, Madagascar's president, took to Twitter to say that he had a successful talks with Tedros Adhanom, director of the World Health Organization. Their discussions, according to Andre Rajoelina, was centered on COVID organics, the COVID-19 herbal treatment discovered by Madagascar. Writing further, the country's president revealed that he and the World Health Organization have agreed to sign a confidentiality clause on the formulation of COVID organics, otherwise known as CVO. He said they have also agreed that the World Health Organization will support a clinical observation of COVID organics in Africa. Shortly after the Twitter message of President Andre Rajoelina, the office in Madagascar released the video chat between Andre Rajoelina, Tedros Adhanom.
Indésirables et des effets secondaires sur les patients traités par ce traitement. Ce traitement donc a présenté un risque.
In the video, Madagascar's president is heard making a review of the state of COVID-19 in his country to the World Health Organization leader.
Organics qui a été établi par nos chercheurs. Et donc nous avons utilisé de l'artémisia.
This comes after the World Health Organization announced plans to get in touch with Madagascar on COVID organics. Madagascar has confirmed 371 COVID-19 cases with 2 deaths and 131 recoveries, according to data compiled by the U.S. Johns Hopkins University. On Sunday, Rajoelina urged the public to protect themselves from the novel coronavirus by drinking CVO, COVID organics. Madagascar has sent CVO to several African countries, including Comoros, Guinea-Bissau, Equatorial Guinea, the Democratic Republic of Congo, Liberia, Niger, Tanzania, Nigeria, Senegal, and Chad.
COVID organics gaining grounds in the fight against coronavirus. Talking Point is up next. Dr. Ivo Dita, a public health expert, assistant professor of medicine at the University of Minnesota Medical School, is joining us from the United States of America. Thanks, Doctor, for joining us today.
Thank you very much, Mr. Babila, for once more inviting me. I want to extend my greetings to the millions of Equinoxe Tv viewers all over the world, and it's my pleasure to join you again on this edition of Talking Point.
What do you think about the speedy increase of COVID-19 figures in Cameroon? Close to 4,000 confirmed, over 4,000 confirmed COVID-19 cases already recorded.
Yeah, certainly this is very concerning. As a public health expert, these numbers are very worrying. In fact, if you look at yesterday's report by the Minister of Public Health, for the first time, Cameroon recorded more than 500 cases of COVID-19 in 24 hours. This is very worrying. The first thing, if we look into these numbers, there are certainly several hypotheses that we can generate to rationalize why we may have seen such a large jump, which I hope we can go into. But to keep it simple, we can simply say these numbers perhaps represent an absolute increase in the number of people in Cameroon who are getting COVID-19. The second hypothesis could be that perhaps the Cameroon government has simply ramped up testing for COVID-19, and that's why they are beginning to find out that a larger proportion of the population actually had COVID-19 that we may not have been aware of. Again, Babila, we can get into the details if you would like us to do that.
Now, the country has recorded her highest number of confirmed COVID-19 cases in 24 hours after government decided to lift some restrictions that were imposed within the context of the fight against coronavirus. Do you see any link between the rising figures and government's decision?
Oh yeah, certainly. If we look at the first hypothesis, why we may have seen this significant increase in the number of COVID-19 patients, it could simply that the disease is spreading more and more in the general population. And if you look at when this first started in Cameroon, the government had the restrictive or the barrier measures in place. At that time, we were seeing some increases, but these were quite small. And the government read into those numbers and probably thought that perhaps the magnitude of the problem, which they had thought they were going to face, is not longer the situation. But now that we see a direct relationship or a temporal association between softening the barrier measures and having an increase in the absolute daily count of the number of patients with COVID-19, it is easy for everyone to probably sit back and say, well, this is probably a consequence of the measures that the government has softened, which were perhaps helping our general population not acquire this infection at the same rate. So I think it is an opportunity for the government to probably look back and evaluate these steps that they have taken to see whether were these the right things to have been done? Are we moving too quickly than we should have? Of course, around the world, we know that every country, because of the economic impact of COVID-19, are beginning to soften their measures. But this should be done in a very careful way that balances how the economy recovers and human survival. I've always stated on this program that we can always rebuild the economy, but unfortunately, when people have died, we cannot revive them. So it is an opportunity, I think, for the government to re-evaluate their strategy and see whether there is something they are doing too rapidly or that they should cut back on.
In President Paul Biya's address to the nation on the 19th of May 2020, he called for discipline and responsibility on the part of the population and united that Cameroonians should unite against the common enemy, the coronavirus. But this seems not to be happening. Where's the problem?
Again, Babila, I'm not surprised. I mean, you know, a lot of times people in leadership do a lot of talking, but we don't see enough action. We have discussed, I've listened to the civil society in Cameroon talk at length why they think the measures that the government has put in place are probably not working as well as they were intended. Yes, on face value, these are important measures. These measures are supposed to work. But we know that when you have such measures in place without accompanying measures, without the things that will make it easy for the population to adhere to those recommendations, we are not surprised that we are seeing what we are seeing on the field. When the government says, yes, we've opened up bars, people should go to the bars, but they should continue to social distance, they should put on their mask. You and I have gone to this, have witnessed crowds of individuals in such bars with no possibility of social distancing. How then can we do that? So the government needs to stop talking. They need to put measures in place that will allow these people to be able to put into practice what they are saying. Otherwise, we will continue to see such numbers like we saw yesterday in Cameroon.
In the far north region of the country, as it is the case elsewhere in many parts of the country, including big cities like Yaoundé and Douala, there are complaints of inadequate water supply. And the people are saying, without water, we can't wash our hands. And in this newscast, we saw a locality, Mesondo in Nyon and Kele Division, central region of the country, where electricity supply, there has been no electricity supply in the locality for over 8 years. And this problem of electricity, inadequate electricity, water supply is just everywhere around the country, and these are some of the difficulties highlighted by the population to justify the non-respect of anti-COVID-19 measures of government and the sanitation rules of the World Health Organization. But on the other side, the administrative authorities are saying the people are indisciplined.
Yeah, so again, this is the disconnect between government policy and what is feasible. I mean, we can talk all the theory we want, but the reality is that it's very difficult for anyone to follow these measures. Again, I hate to talk politics, but sometimes it's very difficult not to just laugh at what this government is doing. You ask people to wash their hands. There is no water. What do you expect them to do? I mean, it's just very difficult, Babila, when the government keeps talking. Talk is cheap. Action is difficult. I think it is time this government sits up, caters for its people like a government is supposed to do, and make sure that these people have the means, they have the resources to follow up on these measures. You are asking people to wash their hands. They do not have even savon. They don't have the hand sanitizers. We have seen the issue of masks. The company that was retained to make the mask is asking Cameroonians to pay about 1,300 francs. I ask myself, how many Cameroonians can afford a mask at 1,300 francs? Why can the Cameroon government not subsidize the availability of masks to Cameroonians? I, for one, sitting here, can tell you that I have had to step in my region in Cameroon to provide masks to my population, to the people from where I come from. This is the job of the government. The first job of the government is to protect its people. And if you cannot do that, then I don't know what we are talking about. So I don't blame Cameroonians. Sometimes it's just very difficult. When you are living from hand to mouth basis, there is no way you can sit at home without going to work because you don't have the mask. If someone is hungry, Babila, there is no way you can ask him not to go to work, whereas because he might catch the virus, whereas he is hungry. He might even die before the virus comes to him. So again, the Cameroon government, in my opinion, needs to be doing much more than they are doing at this moment. These instructions are good, but they need accompanying measures to make sure Cameroonians can follow them.
Dr. Ivo Dita, let's talk about African traditional medicine that seems to be gaining grounds in the fight against coronavirus. He agrees. Archbishop Samuel Kleda indicates that his herbal medicine has treated over 1,000 persons, and now the United Nations, or the World Health Organization rather, is supporting the COVID Organics Initiative of Madagascar. Is it a sign of hope for African traditional medicine to finally emerge?
Babila, I cannot tell you how excited and happy I am. I think this is one of the moments where perhaps African traditional medicine may finally see the light of day. I think this is a very important step. All along, we have complained, have often decried that perhaps African traditional medicine is doing a wonderful job. But one of the drawbacks or the criticism has always been that we do not know what they are doing in terms of we don't know what the medicines contain. We do not know their side effects. We do not know the appropriate dose that may work. So this is a first time that the WHO is seemingly gaining interest in what we have been doing for year in, year out in Africa as pertains to traditional medicine. So I am very excited. The details of the discussion between the World Health Organization and the President of Madagascar are beginning to come out. And it is very encouraging to see that finally we might begin to make some significant grounds in documenting African traditional medicine in a way that is generally acceptable by the scientific world. So this is very impressive, and I am very excited. And as you rightly stated, there is a lot of hope. My hope, again, is that with the Archbishop of Douala, I know the ministry or the government has made contacts with him, and I am hoping that the WHO will come down as well. But the step that the Cameroon government has done in getting in touch with the Archbishop of Douala to see whether they can scientifically show that his medication is working is an important step. But we must continue in that process. Our governments need to support traditional medicines. In other countries, at the ministries of public health or research, there is a desk for that represents traditional medicines in those countries. Our government needs to step up. They need to do more. Have something within the government where these people can go to so that they can document whatever they are doing in a scientific way that we can also show to the world that Africa is up and standing.
You are a medical expert, and there's a lot of research going on as far as finding the cure for coronavirus is concerned. Recently, there was something that was being tested in the United States of America, and there were positive signs. Now, with regards to African traditional medicine, do we have the possibility of establishing the solution, bringing the solution?
Yeah.
Can African medicine be the way out?
Oh yeah, I mean, I think again, I've said previously on your program here that there is a lot of a nationalistic wave going on around the world these days, where countries first look after their own. So you pointed out, and you are right about the vaccine that Moderna is trying to develop in the United States. For the first time, the initial results are very positive and very encouraging. There are signs of hope, that perhaps in the next several months or so, we might have a vaccine for coronavirus. And you are right in asking the question whether when this vaccine becomes available, will it be available to Cameroonians? Will it be available in Africa? So you are right that we have to develop African traditional medicine such that even if the vaccine became available and we do not immediately have access to it in Africa, perhaps African traditional medicine may be the way out of this if we can show that it does work. And there are signs, there is hope. Again, with the WHO coming in, I think I am very positive. And who knows, Africa may be the ones that finally found a cure for COVID-19, and that will be a very laudable effort.
Dr. Ivo Dita, do you have a last word to say before we go? That was Dr. Ivo Dieter.
So Babila, again, thank you for your...
Yes, go ahead, please.
So again, Babila, thank you very much. I think in the fight against COVID-19, there are a lot of positive signs worldwide regarding the vaccine. I am very impressed that the WHO is now in touch with the government of Madagascar to try to see if the CVO or the COVID organics may scientifically be shown to work against COVID-19. But I call on the Cameroon government that the increase in the numbers of COVID-19 that we are seeing in Cameroon, this temporal association with the softening of the measures, of the barrier measures that we know work in COVID-19 may have led to this dramatic rise in the number of COVID patients that we are seeing in Cameroon. It may be time for the Cameroon government to step back, re-evaluate, and make adjustments as they are needed in order to ensure that we do not have the situation that we saw in Italy or in New York existing in Cameroon. That would be fatal. That would be very dangerous. And of course, the government has a role to play and they must protect their citizens.
Dr. Ivo Dieter, public health expert, assistant professor of medicine at the University of Minnesota Medical School. Thanks for your time.
Thank you very much, Babila.
Thanks, ladies and gentlemen, for staying with us. Do have a nice weekend in the company of our programs. Goodbye.